In the simplest form, type 1 diabetes is a complete lack of insulin due to sometimes autoimmune disease, injury, lack of pancreatic beta cells.
Type 2 diabetes is when the blood sugar levels reach a certain threshold, the point at which complications begin.
The type 2 diabetes can be caused by genetic causes and environmental causes, and of course most commonly the combo of the two.
But there is no typical diabetic patient. We have patients who are very thin, personal trainers, and couldn't look more fit, and somehow they have diabetes, and it's very challenging to treat these individuals. We have patients who are morbidly obese and can barely walk and can barely sit in a chair, and they don't have diabetes. But we look for something called insulin resistance, meaning that the levels of insulin, which is the hormone that controls blood sugars, but if those levels are too high relative to even a normal blood sugar or a normal hemoglobin A1C, this is a risk for later development of diabetes. And sometimes we temporarily treat or we show the patient this deficiency in their body, and we are able to prevent diabetes from occurring. The recent data said that it was over 100 million people probably have a diagnosis of diabetes, and many of those patients don't even know that they have diabetes. Diabetes is a real epidemic in the country, and we really have to figure out how to get a hold of this condition.
Seeing the doctor and getting a routine urine and physical every year is not a bad idea because you're going to pick things up early.
A Dramatic Health production.